Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on Enterococcus under the section of infectious diseases. So the epidemiology of this is that it compromises two different types of Enterococcus. First one is Enterococcus faecalis and the next one is Enterococcus faecium. Faecalis is more common, faecium is more dangerous. And nosocomial faecium, or VRE, which is vancomycin-resistant Enterococcus, are increasingly common and, as you would expect, resistant to vancomycin. In terms of its pathophysiology, they are both bile-resistant. However, Enterococcus faecalis colonizes the gastrointestinal tract. They are both associated with urinary tract infections as well as endocarditis. However, Enterococcus faecium only is also associated with intra-abdominal infection, wound infection, line infection, and biliary tree infections. The management of it is either going to be ampicillin or vancomycin. You would add gentamicin in the cases of endocarditis. If you are dealing with a case of VRE or vancomycin-resistant Enterococcus, it's really important that you consult your local infectious diseases doctor. But generally speaking, you either have a choice of linezolid or tigecycline. Let's do a question. A 65-year-old woman with a history of multiple abdominal surgeries presents to the hospital with fever, abdominal pain, and urinary symptoms. Her urine culture grows gram-positive cocci in chain that are resistant to penicillin and have a high level resistant to aminoglycosides. Which of the following is the most likely causative organism? A. Staphylococcus aureus, B. Streptococcus pyogenes, C. Enterococcus faecalis, D. Streptococcus pneumonia, E. Escherichia coli. If you recall from our talk today, the most likely cause in here is going to be option C, or Enterococcus faecalis, because this is a lady who has coming in with abdominal symptoms and also urinary symptoms, and she's had multiple abdominal surgeries previously. Her urine culture has grown gram-positive cocci in chain that are resistant to penicillin and have a high level of resistance to aminoglycoside. So hopefully that should ring alarm bell for you that they are talking about an Enterococcus. And the only Enterococcus option that they have given you in here is option C. Just very briefly, Staph aureus, remember this is gram-positive cocci that is commonly associated with skin infection as well as endocarditis and quite a few other infections. If you want a full recap of Staph aureus, please click here. Streptococcus pyogenes are very commonly associated with pharyngitis. If you would like a review of Streptococcus pyogenes, please click here. Streptococcus pneumonia is the commonest cause of community-acquired pneumonia, which is the commonest reason for adult inpatient hospitalization in the UK. And if you like a recap of that, please click here. Thanks for listening to this episode of Bite-Sized MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.